Hello, welcome to Muttu Integrative. This is Prashant Muthukrishnan. This video is being made because I had a recent podcast that I came across, and one of the questions in the podcast was two physicians asking each other about, hey, if a woman patient comes to my clinic, be it internal medicine or OBGYN or pulmonary, what kind of lifestyle or diet recommendation do I give them? Because one of them asked me and I didn't know what to say. I just told them, reduce carbohydrate intake and go towards anti-inflammatory diets and, be active, etc. That's where I come into personalized medicine. I wanted to educate that set of doctors because those set of doctors will continue to educate other physicians in the community, and that's where we can touch more lives. Okay, the fundamental concept here is not all asthma is the same. Similarly, not all of the women health issues, including PCOD, endometriosis, infertility, um, dysmenorrhea, fibroids, not all of it is the same. Okay, each disease you can find different phenotypes of patients, and that's what I wanted to educate you on today. And you may already know this, but you may ask me, why is there a pattern, right? And how can I use these patterns to cater also my recommendations according to the patterns, right? That's where I come into Ayurveda as well as integrated medicine. All of the ancient forms of medicine have something in common, and I'm so glad that modern medicine is documenting the evidence behind this. Okay, and I just wanted to briefly show you here that yes, I do follow evidence-based medicine and I stand by it. And yet another aspect of current day knowledge is called as practice-based evidence, right? Years and decades of practice has been documented in ancient literature, may not be in the form of a randomized controlled trial, but in huge case series as review articles, etc. Right? So what I'm going to show you today is something called body constitution. Okay, body constitution, you have three different kinds of combinations of phenotypes within us. Okay, one is called as vata, and the next is pitta, and the third one is kapha. And you can see the subtle differences in the image shown here. And we see patients coming in with all these different types of patterns into our women's health clinics, right? And what I wanted to show here is that this fundamental concept of humorisms has been there in Greek medicine and ancient medicine for years together, and we need to get back to this. Uh, so, so you have air, water, earth, fire, and space, and this leads to combinations of humorisms that ultimately decide what kind of phenotype each person is. There are four common phenotypes: sanguine, choleric, phlegmatic, phlegmatic and melancholic. This has been there in Greek and Hippocratic times, where you choose the yin and the yangs. For example, if somebody is phlegmatic, then they choose choleric foods. Similarly, choleric people should use phlegmatic foods. And I defer you, to your own leisure times where you can spend some time looking into such material online. And so many times I see in my asthma clinic that women patients come in with certain patterns of gynecological disorders. If you go into their history, you'll see, I see obese patients, sometimes not too obese patients coming in with asthma, and they have certain pattern of gynecological diseases along with them. So that's what I would like to focus on here, is that you need to understand what is the body constitution of this patient, and therefore, after I identify the body constitution, I can accordingly give them the right kind of recommendations regarding lifestyle and diet. A simple example would be, uh, um, say, somebody who has vata, which is a lot of air and space, right? classic example would be Audrey Hepburn, right? Very creative, innovative, lightweight, moves around a lot, right? These people, right? If they are in balance, if vata is, which is air and space, is in balance, and how can you make that in balance? By maintaining routines, right? Minimizing unpredictable schedules. And if you are air and space, then you don't want more air and space. So you don't want temperatures or foods that are more alike with air and space, which is you don't want dry foods, cold foods. You don't want too many movement related activities, right? So these are certain examples that I would like you to look into. I cannot make a complete lecture about Ayurveda here, but this is prevalent in all forms of medicine. You may be from Middle East, you may be from Europe or China. Yes, your own country has this in their own integrative or traditional medicine. So you need to go back into your own literature from your own country and start looking into it, because Americans, we all came from different parts of the world, right? When we live in America, be it a European, you go back into your own literature and look at what information you have. Similarly, there are certain other women patients who come in with history of migraines, and they have certain pattern of gynecological diseases such as dysmenorrhea, heavy bleeding, etc. And that's where you need to find out what recommendation can I give this, because just carbohydrate, protein, fat-based recommendations is not the way to go. That's the crux of this talk. Do not restrict your recommendations to decrease carbohydrates, increase your protein, and try to minimize the fat, and then walk a lot. And some patients say, I exercise a lot, and that's because they have not identified the body constitution. Because vata, for example, is the fact that the flow of energy, the flow of normal peristalsis and the mucosa uh, movement of fluids and the impulses in the CNS happens in a certain flow direction. And if that is not handled well because of your unpredictable schedules, that's what causes vata imbalance. And that is what leads to diseases such as retrograde menstruation, which is the theory behind endometriosis, for instance, right? So I have a lot to share here, and if you are interested in learning a little bit more, I will be happy to, have chat with you. And similarly, kapha people are full of earth and water, and they're more, um, predictably uh, susceptible to things such as obesity, metabolic syndrome, PCOD, and such. And therefore, for those patients, mobility is going to be helpful, whereas not for vata people, right? Vata people are already mobile too much, and they need to sit down, they need to ground themselves. Similarly, kapha people are supposed to eat hot, spicy things, as against vata people, they are not supposed to eat spicy things, but they would rather grounding things such as salty foods and sweet foods. So there's actually a chart online for Ayurvedic dosha-based diets. And so you go online into your own online calculator for dosha or body constitution or prakriti, Prakriti, and you will be actually able to give your own patient and yourself personalized recommendations for lifestyle diet. And, uh, and so these are examples for the meridians. So these meridians follow the CNS pathways, and therefore that's why Chinese medicine works on these pathways. And by trying to direct the flow downwards, for instance, in endometriosis or dysmenorrhea. And if there is excessive forces or stagnation of certain channels, according to Chinese medicine, then that's where they improve the flow. So you need to know more so that you can advise your patients better. And that's one of my um, main goals, what I have tried to do during my life. There's immense literature in online with gynecological organizations that function with Ayurveda. They call it Gynoveda, right? And And here you go with the retrograde menstruation theory. Um, and what you see is suppression of natural urges. So people ask, why do I get this? Why do I have endometriosis? Well, every time you have a natural urge towards a downward flow, right, which is time to pee, time to poop, um, and when we, for example, sleep in and wake up late and do not get up to pee and rather just continue to sleep through it. Those are some instances. Similarly, when you are at work and you are incessantly working and do not give yourself time for nature calls. Similarly, not and when your stomach is already hungry and you've not fed the stomach, when the peristalsis gets affected because these neuro impulses that work on feedback, if they are not fed accordingly, then those are the things that lead to dysregulation of these natural forces that ultimately cause imbalance of these natural forces, leading to accumulation of disease. And that's why one of my slides shows that not all disease manifests right away, but actually accumulates over time. And eventually, all vata predominant diseases manifest as hypertension in the future. Similarly, atrial fibrillation in the cardiac arrhythmias. So that's something you need to look into, is just because you have endometriosis or some of these gynecological diseases and you take care of them peripherally, that doesn't mean that you've fixed your underlying root cause. Okay, so you have to make use of a little bit of modern medicine to control symptoms. Similarly, make use of a lot of traditional integrative approach to fix the lifestyle that's leading to all of this. There's immense literature on Unani medicine, for instance, and the humorisms that I have mentioned. People did this in Renaissance. This is a Shakespeare website where he talks about humorisms in Renaissance, and people knew this, and we've forgotten a little bit. Uh, but I'm glad that modern medicine is indeed documenting this. Okay. And so yeah, so if you are interested in a little bit more of detail to this, you can consult your own Ayurvedic physician in your locality, or I'll be happy to spare some time and share a little bit more knowledge with you guys. Thank you very much.